The way that I would explain OCD is that your mind is torturing you 24/7. I am talking about my OCD story. Now, the reason I want to redo that video is because I did really feel like it was an important thing for me to talk about on my channel. I, as you know, if you've been here before, suffer with OCD. I also have BPD, anxiety, and have struggled with depression and an eating disorder, all of that good stuff. But I do feel like videos like this, where people sit down and actually talk about their disorder and how they feel, just helps so much with people that might be struggling or thinking that they might have OCD or BPD or whatever it is that they think that they're suffering with. Just feel less alone and more heard. I'm going to split this into 4 sections. So I'm going to talk about my initial symptoms, and then how I got diagnosed, and then my treatment, and then where I am today. If you don't know what OCD is, I have gone into more detail on other videos in my channel that I will link below, but OCD stands for obsessive-compulsive disorder. There's a massive misconception that OCD means being clean or tidy or almost like a personality trait or quirk. It's not. OCD is being classified in the medical world as one of the most debilitating medical conditions. So that's not just mental health, that's out of all of the medical conditions, it is one of the most debilitating. Now, I understand why a lot of people have that misconception, because that's how it's been portrayed in the media for such a long time, but that is not what OCD is. OCD is a mental health disorder that causes intrusive thoughts and images that people can't control, that then can also cause them to have to act out mental or physical compulsions. OCD is very complex and no two people suffer the same. The thoughts can be different, compulsions can be different, whether or not the person has the thoughts, compulsions or images can be different. And obviously I'm not a medical professional, so everything that I'm talking about today is just based off my own experience with OCD. Now, talking about where my OCD starts, I would say my OCD started around about age 6. I think that's when I did start to show signs and symptoms of something not being right, but as a child does act in different ways and goes through phases, it wasn't really picked up. It wasn't really seen as there's definitely something not right there. So the first thing that I can really remember is that I used to have this obsession with things not being over the edge. Say if there was a coaster over the edge on the table, I would really get very distressed and really upset about it. We used to have a living room door that would shut, but it'd only make a clicking sound if you really pushed it, and I had to hear that sound in order to feel comfortable or safe. So if somebody was coming in and out of the door and they didn't push it, I would be shouting down the stairs, even when I was meant to be in bed. And one of the biggest signs I would say is that I am emetophobic. That means that I have a severe fear of sick or throwing up. It is hard to say the word. Now, when I say I'm scared of sick, I know that people don't like sick. Nobody likes being sick, but it's to have emetophobia, it means that you're consumed by the fear. It's not just disliking it, or when you're unwell being upset by it. It's the constant fear and avoidance of situations that might cause you to be ill. Now, that, along with my OCD in combination, kind of came together to make a hell that I was going to live. Now, when I was a child, as I said, I had a few signs that were there, and they just started to slowly progress as I got older. I became obsessively afraid of sick. All I could think about was that I was going to be sick, and then I would have these visions or images in my mind of being ill, and it terrified me. And I think because OCD will make you imagine the worst thing that you can imagine, and that to me at that time was sick, which might sound silly to other people, but that's where it was. I would have these visions of being sick. It would run through my mind constantly. Every time I came into contact with someone, I would think maybe they looked a bit ill, maybe they were ill, and then I'd start feeling ill, and then I would start acting out compulsions. I had begun counting from a young age. So I would walk, but I would count every 4 steps, and I would chew in 4s. I would go up the stairs in a certain pattern. If I did the pattern wrong, I'd have to start again. If I lost track of my 4s, I would have to start again. And I mean going back and starting again, not just starting again, counting in my head. And I would need to do these actions because in my mind I believed, and the OCD makes you believe, that if I didn't, I would be sick, I would get ill. But this just progressively got worse as I got older. The compulsions got worse. I had a lot of compulsions. I had a routine I had to do before I got in bed that took over an hour. I would have to start again if I thought that I'd messed up. I would avoid certain foods in case they made me sick. I began attaching certain inanimate objects and things to the fear of being sick. So for example, there are films that I watched as a child and I was sick when I watched them that I would not be able to watch again, because in my head my OCD told me that I would be sick if I watched it. And I would attach it to random objects that I owned, so I wouldn't be able to use that object anymore because OCD would tell me that if I touched it or used it, I would be sick. And then not only was I having thoughts about being sick, I was having thoughts about family dying, about natural disasters happening, about anything that you can think of that is horrendous and awful. I would have intrusive thoughts about it, and then I would combat that with compulsions that I was acting out. Now, another great thing about OCD is that it can make you believe that you have done things or could possibly have done things that you haven't done, and it usually goes against everything that you believe in as a person. So for example, there was a time when I was convinced that I was a serial killer and I didn't know it. I thought that I had tried to harm people that I hadn't. It is a very complicated disorder. I remember speaking to someone once who also had OCD, and they said that they used to go out in the car and then they would be convinced by the time they got home that they might have ran someone over and not noticed, and they would have to go back and check. The way that I would explain OCD is that your mind is torturing you 24/7, and that is the best way that I can describe it, especially if it's untreated. Now, I went years before being diagnosed with OCD. Eventually, I was referred to counselling, just needed a higher level of support and care at that time. So then I went to CAMS, which here in the UK is where children are referred to if they have psychological problems or mental health issues. I had some great help from CAMS, but also some not very good experiences as well. I was first diagnosed with OCD, anxiety disorder. OCD is also a form of anxiety disorder, but anxiety disorder and depression. And then I was later in life, I was also diagnosed with BPD and an eating disorder. Being diagnosed did take some time. I know for some people it can take years. The reason it can take so long is because, as I said before, 1, OCD is massively misunderstood. 2, there didn't used to be that much of an understanding from all medical professionals about OCD, and because OCD can come out in people in so many different ways, it can be difficult for a doctor or professional to recognise it straight away. It's definitely getting better. People who have OCD might not have compulsions, they might just have the intrusive thoughts. Some people might just have the intrusive thoughts in regards to believing they've done something or that they are something. People have the intrusive thoughts, images and compulsions, and then what their intrusive thoughts are can change. Some people can be completely just in relation to contamination, some people can be in relation to religion, some people in relation to their sexuality. It is so diverse of a disorder that it can be difficult to get a diagnosis. I was lucky that I got diagnosed quite young. Some people would say that I had the very obvious OCD symptoms and it would have been a little bit easier for them to diagnose me, but even I struggled initially, especially being a child, because I found it difficult to explain the thoughts and images that I was having. Trying to explain to somebody that you think that you've done something that you haven't done as a child who is in a lot of distress is difficult, and that's where my problems came from. But eventually we got there. What I would say now, if you are someone who does think that you might have OCD, when you go to the doctor, just mention it if it's something that you think that you might have, because sometimes all it takes is for you to bring that up, and then they will think, oh, okay, maybe that does add up, maybe we should send you for a referral, maybe that sounds like it is something you might be struggling with, but they might not necessarily have thought of it themselves just based off one appointment, if that makes sense. So I definitely always say be your own advocate. If it's something that you are concerned about, don't be afraid to speak to someone. Now, after my diagnosis, I had some treatment for OCD. Initially, I was put on medication. Now, I am an advocate for taking medication if it works for you, but at that age when I was put on the medication, it definitely didn't. It made me significantly worse, and it did actually result in an overdose. I, as I said, was very depressed at the time, very confused. I also had a lot of trauma going on at home, and on top of that, hormones, teenagers, and then the medication on top of that. I just don't think it was the right time, or that I was in the right place or age to be on the medication. So we tried medication. I ended up coming off that medication, and then I also did CBT, which is cognitive behavioural therapy. The whole idea behind cognitive behavioural therapy is to retrain the connections in your brain. For example, you have a belief because of the thought you're having, and you believe because of that thought you have to act out said action in order to prevent that from happening. It's about trying to break the links between those two things, and to show your brain and to rewire your brain to understand that this action won't affect this outcome. So I did that for a while. Again, I wouldn't say I was in the best place at the time to be doing it. However, it did help. So I did sort of get control over the OCD again for quite a few years. And then I had a massive relapse in my mental health altogether, and my OCD really did take over again. This has to go back. This happened a couple of times, but the most recent time was about 18 months ago, and I was very ill, and I ended up getting help, and I went on some medication and also a therapist. Now, the medication took a little bit of time to get right. I'd been on and off medication throughout my years since I was a child, and I've finally found medication that I think works, and I have done a video on the medication that I take. In case you are interested, I'll leave it linked below. I take 2 medications. They have helped, but I've also had therapy, and then I'm also now doing trauma therapy, which is again a way to not necessarily heal the OCD, but to try and understand and relearn my thinking and how my brain works, and process things that have happened to me, because when you've got a lot of unprocessed trauma, it can come out in other ways, such as your OCD or anxiety or depression. So the treatment that I have had, there is also a treatment which is called exposure therapy. This is something I have never had. I do know that it has worked for other people. I personally have never been or felt comfortable enough to do exposure therapy, but it effectively is as it sounds. You are exposed to the thing that you are concerned about to show you that it is not harmful, or nothing bad will happen from being exposed to that thing. Now, sorry if the camera or the angles changed, my battery died and I've had to start filming on my phone. So yeah, as I was saying, in terms of where I am today with my OCD is definitely still there. I've never fully got rid of or overcome my OCD, but I would say from a younger age and for a lot of my life, I would have described OCD as being anywhere from 80 to 95% in control. I would say right now OCD is maybe 20% and I'm 80. That might sound like a lot, but for somebody like me who used to be controlled completely by my OCD and the thoughts and compulsions, actually having 80% of control is massive. I still work on the 20%, but it is things that I can kind of deal with. I say something before I go to sleep that I have said every night since I was about 6, and I will probably continue to say that. And in all of that time that I've said it, I would probably say I've missed twice, 2 nights, 3 nights, and if I've missed it, I will have said the next day something else additionally in my mind to override the fact that I missed it. If you're someone that doesn't have OCD or who doesn't have the same issues with it, you might be thinking that sounds crazy, and it does sound crazy, and I understand it's not very logical, but OCD is one of the most unlogical things. Now I still have intrusive thoughts, but not to the extent I used to. I am getting better at recognising the thoughts as just OCD and not actually me and myself. I do have bad days, I have bad weeks. If something bad happens that can trigger it, then it definitely can go back down, but I've got better at recognising the progression before it progresses too far. So I will reach out to my doctor, I will speak to my partner or to my sister, and it's about having that support in place. If you think that you are going backwards, get help before it gets too out of control, because it's always easier to get that control back if you get it initially. Now, if you're someone who's listening to this and thinking that sounds like me, then please speak to a doctor. It will be scary, but it'll be one of the best things that you've ever done. OCD can rob you and has robbed me of so many years of my life. It doesn't bear thinking about, and I just don't want others out there who potentially, anyone out there who potentially could be suffering in silence to lose as much life and memories and things that didn't happen, or that I didn't go to, or that I was miserable for, when they could just get help. It is scary, but having that diagnosis can open up so many different treatment options for you. So please do reach out, ask for help. If you've got any questions from me, just leave them in the comments down below, or I'll leave my social media handles, I'll link them down below as well. I will always be happy to answer any questions. If you're somebody who's watching this who does have OCD and you think that really sounds like me, again, just get in contact. We can have a little chat, we can talk about our different experiences. I'm always up for learning about other people's experiences. And if you're somebody who's watching this and thinking, I haven't got a clue what this girl's talking about, this sounds completely alien to me, then if you've got any questions or you want a bit more information about it, maybe your family members are struggling and you want to know how to support them properly, then again, just get in touch. I'm always happy to have that conversation. And if there's anything else or any other topics that you'd want me to go over, then please just let me know, leave a comment. I think that's everything for now. I do a lot of mental health videos on this channel, and I also do lifestyle as well. So if you've liked this video and you think that you'd want to see any more, please consider subscribing. And if you have liked this video, please give it a like, because it really does help get the video out to more people, and hopefully we can help more. So wherever that you are, I hope you have a lovely morning, day or night, and I'll see you again next time. Bye.